thank you. Really happy to sponsor the event this afternoon and be here as well. And it's very important as well to have those conversations at the end of the meeting as well. I've already spotted a few people I like to have some one-to-one conversations with afterwards. So an important part of the event today. But can I first of all thank Dr. Rowena for her opening comments. It's really important, I think, isn't it, to the links between patient and GP. And I think about my own life. Fortunately, I've not had to see in my life a GP very often. But I often get advice from different people in my life. I get advice from my family, from my friends, some of my colleagues I can see here. They give me advice, and I take that advice or I leave that advice. But when it comes to the times when I've seen my GP, I almost certainly always take the advice, their advice. I trust my GP. I have that ability to have that confidential conversation with my GP. And that is, of course, crucially important. And the event today, talking about that relationship-based care, is so important. And that link, of course, must be strengthened. I think as well, of course, we know that during the course of the pandemic, there's been some real challenges in terms of that link. We've had to work differently. But I think what's important is that we build back in a better way and learn from some of the issues over the pandemic to make sure that we retain those links as much as we can to ensure that that relationship remains between patient and clinician. And again, I agree with Dr. Rowena. It's important that those links remain there, that strong relationship remains there, because ultimately that leads to a better health outcome. If I think about my own life as well, when I go shopping, I tend not to know who the store manager is in my local supermarket. But in the past, you would have known. Everyone would have known who their local shopkeeper was, and there would have been this is the family doctor, and the family doctor is there and has been there for decades, and there's that relationship that's built. But the minister touched on this. We live in a different world now. In my own constituency, many people move to Mid Wales to retire. And often a few years after they retire, they tend to more then need to visit their GP. But that relationship wouldn't have been built up over many years. So I think it's more challenging as people move around the country more frequently, and they move around within an area more frequently. So there's plenty of changes in society which alter the way we see a GP and the way we have a relationship with a GP. But I think, as the Minister said in her comments, although we do have to work differently, and although there is a difference in working following lifestyle changes and the way people live, and also the very fact that the pandemic has changed the way that we have to work, what the Minister said, which I think was quite right, was that we can retain some of the principles of the strong working relationship between patient and GP. We can pick elements that don't have to change as a result of the changes that we have to now work by through the course of the pandemic, and lifestyle changes as well. As chair of the Health Committee, our job, of course, is to scrutinise the Minister, scrutinise the government. We do that on a cross-party basis, and in some of the issues that are talked about today, cut across quite large parts of our work on Health Committee. So often the invitation is there as well. We often have call-outs for evidence. And we often get the same evidence from the same groups of people. But very keen, as a number of GPs here today, very keen, if you follow some of the work of our committee, very keen to be able to speak to you and get your personal experiences on a lot of the work that we undertake on the Health and Social Care Committee in the Senedd. But I think the many reports that I come across as my spokesperson's role and as chair of the Health Committee talk about the benefits of a relationship between patient and clinician. So here in Wales, I think we need to recognise the value of relationship-based care. So I look forward to the rest of the contributions today, and I can see my colleague on committee, Rhian Olive, is here as well. I think he's perhaps going to Shall I invite him to come and speak now, Nick? Directly after me? I've just kind of done it anyway, so Rhian, do you want to come up after me? But I look forward to the contributions for this afternoon.